Can you take us through the numbers about what you're exactly asking for with the Medicare rebate and why?
Yeah, well, I guess the first thing is people probably need to understand what the Medicare rebate is, and that's the money that you get back from the government after you've seen the doctor. And what we're calling on is for that rebate to be increased for those mental health item numbers and those longer consultations, the 20 to 40 minutes, because we know that that gap has been widening, but people are spending longer and longer with their GP as they get older and sicker and more complicated, and mental health is the commonest presentation to general practice.
How confident are you that the changes in these numbers will help arrest the decline in bulk billing?
So we've already seen that funding drives outcomes, and the government took on the recommendation of tripling the bulk billing incentive, and we've seen how that has stopped that decline in bulk billing and even increased it just in a very short time since that came in. It's really important that we target our most vulnerable, but we also need to recognise that the way the Medicare system is set up at the moment, it rewards shorter high throughput consultations at a time when we know that patients expect we are delivering, but patients are not being supported to have those longer consultations with their GP.
Do you think also that this might help retain GPs in the system? There are some alarming stats about GPs who are looking to leave the system entirely.
Yeah, so we need to look at the attractiveness, the recruitment and retention of general practice. It's gone from when I trained, 40% of medical graduates wanted to be GPs, now down to about 40%. And that's because it's been underfunded and undervalued for a long time. One of the biggest barriers... Sorry.
No, you go on.
Yeah, one of the biggest barriers is for our doctors, after spending 8 years in the hospital system, we need to come out into the community and train. But they're staying in the hospital systems because in GPs, we don't have parity with our hospital colleagues and our trainees with paid parental leave or study leave, so they're staying in the hospital system.
Another prong to your request is the $75 million in incentive payments and 14 weeks paid maternity leave for GP trainees. What is it like for a GP trainee? Would this be attractive and enough to entice more students in?
This is a huge part of attracting people into general practice. 2/3 of our GPs in training are women, and the average age of a registrar is around 33, 34. So we need to be able to provide conditions where they do wish to be able to train in the community and practice, but what many are choosing to do is to stay in the hospital systems, and then often they're lost to other specialties instead of general practice.
Have you quantified what your requests, demands would cost the bottom line of the federal budget?
So the funding is around $75 million, but considering the cost of a patient going into the hospital for an episode of care, it's significantly less. So to see a GP in the community is going to cost taxpayers $40, but if that same person attended the emergency department, it's over $600. So we need to then sort of think, okay, let's get more doctors into the community, let's keep people out of expensive hospitals and make general practice funded and valued once again.
Do you think there's going to be political appetite or even fiscal appetite for it, given you mentioned just before the tripling of the Medicare levy to entice bulk billing for certain kids under 16, pensioners and concession car holders? That was the largest investment in Medicare in 40 years. There was also the indexation element there that was going to cost $1.5 billion. Given we saw that huge overhaul in November of last year, how realistic are your expectations here to get this across the line with the upcoming May budget?
So last year stemmed the bleeding. After 10 years of neglect by successive governments, the patient's Medicare rebate, when they see their GP has been neglected and has not been indexed. And it's only now that we're starting to see a turnaround. As I said, funding drives outcomes. If this government wants to see a difference in the community, if it wants to keep people out of expensive hospitals, it needs to fund general practice and primary care.